Hello everyone. Today I am going to present what to do when your cat does not eat. Obviously, you can use that with your FIP cat, but also with any cat that has a decrease in appetite. First, a bit of history. The domestic cat is Felis sylvestris catus and comes from an Egyptian cat called Felis sylvestris libica. This species is a solitary species and predator, which means they live alone, they see other cats only to mate, and they count only on themselves to hunt and to avoid injuries. The cat were domesticated 6,000 to 8,000 years ago, and the first remains were found in Cyprus. But the domestic cats today retain ancestral features, and it's important. Because, for example, the cat has a face that is not very mobile and it still has a predator instinct, so it will not show weakness, which means that the early signs that a cat is not well are non-specific. For example, an appetite that decreases, they're sleeping more, they're hiding more, and also they are refusing interaction. We are going to focus on appetite. So what do we mean by decreased appetite? The cat will not eat enough daily to maintain the appropriate weight or his usual weight, and the cat will not eat the usual daily amount of food. The interval can be wide though, so from eating 90% of the daily amount to 0%. What is important is the percentage and the time. Obviously, if they eat 90% of the daily amount for one day, it's not very serious. While if they eat 90% of their daily amount on 3 months, then they will lose weight. So it means that you should know how much your cat should eat per day. So it depends on age, neutering status, weight, activity, if they go out or not, condition, if they have diabetes or chronic kidney disease, for example, and sometimes breed. It depends on what food the cat is given. For example, if it's industrial food, you have to follow recommendation on the food packet, dry and wet food. If you are preparing food, you have to follow recommendation on a complete and healthy diet and respect the quantities. And it's important to see that either with your vet or with online veterinary advice, because it's very important to get it right if you're preparing food. So, for example, I have a healthy Newton-made European cat, healthy weight at 4.6 kilo indoor, and he has 80% dry grain-free kibbles and 20% wet food. So I looked on the various packets, and it says for the kibble 50 to 70 grams for 4.5 kilo, and the wet food is 3 to 4 pouches for 4 kilo. So I choose to give him 50-gram kibble plus 1 pouch per day. And how do I know if it's right? I monitor the quantity, but I also monitor his weight. What is a healthy weight? For example, a growing kitten will put on 50 to 150 grams per week on average between 5 weeks and 4 to 5 months. It's variable over time and breed dependent. Then there will be a slow growth up to 1 year, and the neutering will influence the need for food because a neuter cat will need less food to maintain a weight or an adapted food. In adult cats, weight variation should be minimal, below 5% variation on average. So it means the cat can put on up to 5% weight or lose up to 5% of its weight, but not more. How often should we monitor weight? For an adult healthy cat, I would say once a month. For a cat that has a condition that is controlled, I would say twice a month. For a kitten, I would say once a week. And for a FIP cat, I would say every 3 days. You can also monitor body scores, looking at the picture on the right, and you can see if your cat is too thin or ideal, or overweight, for example. Decreased appetite in cat, why is it so important? So as an example, if a cat eats 80 to 90% of daily amount over time, then it can lead to decreased weight, and we see that in chronic conditions such as kidney disease, liver disease, and mouth problems. If the cat eats 50% of his daily amount, it can be seen in acute conditions such as gastritis or pain in general. But if the cat eats 0% of his daily amount, it's an emergency, because either it's because there's a life-threatening condition such as poisoning, foreign body, acute bacterial or viral infection, there is FIP, but also it can lead to hepatic lipidosis, which is a life-threatening condition in itself. So what is hepatic lipidosis? It's an accumulation of triglyceride in the liver. It's triggered by anorexia, the cat not eating, and it's worse in overweight cats. Why? Because fat from the body is used to give energy to the cat when the cat is not eating. And if too much triglyceride arrives to the liver, then the liver becomes a fat liver and it leads to hepatic lipidosis. It's, as I said before, a life-threatening condition, and you can recognize it with the lethargy, a weight loss that can be drastic, a vomiting, and a jaundice like on this picture. So, how to react if your cat has a decrease of appetite? First, you measure the decrease of appetite. Then you try to entice the cat to eat without forcing him or her in case it's a foreign body. You can try to take the temperature if possible. When resting normal temperature is around 38 degrees Celsius to 38.5. So you can see if there is fever or not. And if your cat eats less than 30 of his daily amount for more than 24 hours, you call your vet. It's very important. You do not wait, because it means that your cat has a problem. Now I am going to talk about the direct causes of decreased appetite. For example, it can be a dental or a mouth problem. It can be dental pain. The cat can show a difficulty to chew. It can be gingivitis. As you can see on this picture, the cat's gums are red to purple, which shows inflammation. It can also be nausea. Of course, nausea is present in lots of conditions, including FIP. But how will you recognize it? The cat can seem to eat from the side of the mouth, also show difficulty to chew, but without any dental or gum problem. The cat can show lip licking or exaggerated swallowing, often in front of the food, and also the cat can retch. Let me summarize the process. If your cat eats less than 80% of its daily amount of food over time, or 0% of this same amount of food for more than 24 hours, you call your vet. Your vet will be able to give you a diagnosis, if possible, and also to recommend treatment for the condition if the condition is identified, or symptomatic treatment to relieve your cat of its symptoms. For example, for a dental problem, treatment will include pain management, antibiotics, and only if needed, dental extraction. As for nausea, there are three possibilities: anti-thrombin medicine, anti-acid medicine, and gastroprotectant. And your vet will provide one, two, or all of the above, depending on the cause and the severity of the nausea. Your vet will also be able to provide an appetite stimulant if needed. Once you are back at home with your cat and you know what your cat has, then you will be able to entice your cat to eat, and if it doesn't work, Then I will talk about how to properly force feed a cat and also what happens if a cat is hospitalized. How to entice your cat to eat. First, cats are strictly carnivores and they are not scavengers. So they need super fresh food and they need meat regularly because they are not able to synthesize specific amino acids that are found in meat. They need small meals, so when you entice a cat to eat, you need to do up to 10 meals per day. Why? Because what goes in must stay in. And if you do a bigger meal, maybe your nauseous cat will throw up. Also, you need to try an elevated football like on a picture. Why? Because then the cat is in more upright position, as you can see on the pictures. The picture on the left, the football is on the floor. The picture on the right, the football is elevated, and so the cat is in a more upright position. Also, you need to warm the food because the food needs to be smelly. Why? Because cats, when they are not feeling well, usually they have a decreased sense of smell, and so it's difficult for them to smell the food and to be sure that it is food. Also, you can try hand or figure feeding because the cats will take more voluntarily food from the finger or the hand of their owner than if they have to go and seek the food themselves in the bowl. For example, here is a video, and you can see me hand feeding my cat that is very happy to lick my finger. What can you give? First, you prepare always small quantities because when a cat is not feeling well, they will eat really a small quantity of food. And if you prepare something in large quantities, you will end up throwing all the food away. So you can give anything that the cat would like and can digest. So, for example, wet food that is warmed, dry food if they prefer dry food, or soaked kibble with warm water, for example. You can give raw meat such as minced steak, chicken, or tuna or fish, for example. You can give meat with fat, for example, chicken fillet with butter, not overcooked, because they usually like fat. You can also try yogurt and cottage cheese. So you can try really a lot of things, but you can also try liquid or gel supplement and liquid food. The important thing is always to prepare small quantities and also to try only one thing at a time, because the cat is not feeling well, so a buffet is not necessary. I will now talk about liquid food and supplements. Those products are specifically formulated for ill or weak animals, and it's very interesting because normally there is all that your cat needs to be better, and also it's ready to use. You don't have to prepare anything, you just have to buy it. But you have to make the difference between what we call liquid food, such as recovery liquid from Royal Canin. This is a liquid food, which means it's a complete diet, which means you can give that to your cat. And normally, if you respect the quantities or if you exceed the quantity, your cat can live with that food, really, if you give it every day. And then you have the supplements. The supplements, for example, NutriPlus gel, they are supplements. So they are designed to help your cat if the cat is not eating much. They are still of interest if your cat is not eating at all because they are hypercaloric, hyperproteinic products. But it needs to be clear that there are supplements, and so if your cat eats only NutriPlus gel for several days, your cat does not get everything that it needs. So here, Nutripress gel, it's very good because it's a gel, it's a fish smell, so it's very smelly. It can be very appetant, and also you can put it on the paws so the cat licks itself and then try to absorb the Nutri-Gel. So it's very interesting. There is another supplement called NutriBound that is a liquid supplement, very palatable, and also because it's a bit thick, it entices the cat to eat and drink. It can be poured a bit on the food, it can be just left on a plate for the cat to lick, and usually the cat will go drink after eating NutriBound. So it's a very interesting product. Again, I'm just talking about the product that I know. It doesn't mean that the other products are not good. It's just that I don't know about them. Those are the ones that I use all the time. And also, what is interesting is that these products can be used in force feeding, which I am going to talk about now. Force feeding a cat, the principles. First, you do not force feed a cat if there is the possibility of a foreign body, because you do not want to make the situation more serious for your cat. So if there is the possibility of a foreign body, I insist you do not force feed your cat. It's best to go and see your vet. Force feeding has to be the last recourse because it can create food aversion, and also it has to be avoided with cats in respiratory distress. Why? Because if you force feed a cat that has a difficulty to breathe, then you can go and give the cat aspiration pneumonia because the food can go into the lungs. So once there is no possibility of foreign body and your cat is breathing normally, what you use, the product, has to be liquid and just a bit thicker than water to facilitate the swallowing. The product can be mixed food or a ready-to-give vet product. It's not important. The important thing is you know what quantity you have to give over 24 hours to help your cat. Of course, you will prepare things before getting the cat. Then you will sit or stand with your cat in a comfortable position on a towel or a cushion if it's better. Then you will gently place your hand on the shoulder of your cat and your fingers around his neck and under the chin. And you can also have your arm around the cat's body. The heads need to be slightly tilted back, but you should avoid forcing your cat if possible. You just have to have your fingers just below the chin so you can have the head slightly tilted back. The syringe needs to be placed at the corner of the mouth, like you can see in the pictures. And then the tip of the syringe needs to be introduced in the mouth. You don't have to force it, just you introduce it gently, and it can be between the teeth. It's not important. The most important is to give the liquid 0.5 ml by 0.5 ml. So you give 0.5 ml, you let the cat swallow, then you give 0.5 ml and you let the cat swallow. So it's very long and it's very maybe annoying, but it's the way that your cat will not choke on the liquid, and it's the way your cat will, let's say, less hate force feeding. I mean, they will hate force feeding every time, but it's important that they tolerate it. Now I'm going to show you 2 videos of my cats that I force feed. Here is Ator, my cat, and here is Bastet, my youngest cat. So as you can see, 2 different styles of cats. So the first one tolerates force feeding very well and the position is perfect. The second one, she also tolerates force feeding, but she's chewing on the tip of the syringe. It doesn't matter. What matters is she doesn't choke on Doesn't matter if you spill a bit of the liquid. What matters is it's going in and the cat is not choking and the cat will not throw up. Sometimes your cat will need to be hospitalized because its condition is very serious. I will talk about the feeding part of the hospitalization. Sometimes the cat will be able to feed himself on its own, but sometimes it will not be able to do that. Your cat will get intravenous fluid to hydrate him and also to give him energy, for example, with glucose in vein. But what about protein? If your cat does not eat over several days, then he will need protein for its body to fight the disease. And if the cat does not eat, the cat will need force feeding or a feeding tube, as you can see on the picture. It's very important because the feeding tube will enable the vet to give your cat liquid food directly in the esophagus, so directly into the stomach. And this feeding tube usually is placed with sedation, but can be done without sedation when the cat is very poorly. It's important that you know that. In conclusion, monitoring appetite and weight are vital for the cat's health. The cat needs vet attention quickly if the appetite deteriorates. You will always try to entice the cat to eat first, using small quantity, lots of meals, one thing at a time, and hand feeding. And force feeding is the last recourse, but need to be done if there is no other way. Again, small quantity, lots of meals, and let the cat swallow. I would like to thank you very much for having listened to me and to thank you for your attention.
Hello, everyone. I hope everyone enjoyed the show. Thank you for tuning into the first Let's Talk FIP show. I'm going now to take some time to answer questions that were not covered during the presentation. So first question, Luna from Australia asks, I have more than one cat. Should I feed my FIP cat separate? Should I feed my FIP cat separate? So it really depends on the cats and their relationship. So if you have a food bowl for every cat, and if your cats all get along well, then you can actually feed your cats together, provided that you provide all one food bowl for each cat. But you still need to keep an eye onto your FIP cat, because you need to know that your FIP cat is eating well. So it really depends how much time you have, because you absolutely need to know what quantity per day your FIP cat is eating. Then we have Paul from Germany. He asks, is it okay to free feed my cats? Well, it depends. Again, I'm sorry, because some cats will eat only what they need, and other cats will be a bit greedy. And so as long as there is food, they will eat. So depending on what type of cat you have, for example, me, I have one greedy cat and one cat that will eat only what he needs. So it's a bit difficult to free feed them, for example. The best way to answer that is to actually monitor the weight of your cats. And if you see that with free feeding, they are putting on too much weight, then you will have to restrict them a bit. Azra from Turkey asks, is more expensive food always better? And how do I know which to feed my cat? Well, I will say no. I mean, what counts in the food is the quality of raw materials and that it's a complete diet. So when you say the most expensive food, I wouldn't say that, because prices vary a lot. But I would say maybe, you have several range, like the supermarket range, the pet shop range, and then the veterinary range. And usually what you see is that the raw material are better when it's a higher range. So I think it's not that more expensive is better. You'd have to check the composition of the food. Well, Adriana from Montreal asks what kind of food is best to feed a FIP kitten with diarrhea. I would say a highly digestible food, and also that you need to address the diarrhea, maybe with probiotics, maybe with a visit to the vet. You need to understand why the kitten has a diarrhea first, and then adapt the food. Julie from New York asks, why does my cat only want to eat hard kibble? So the thing is, cats, for example, like dogs, maybe like us, they form their taste at a very young age. So when you have a kitten, it's good to try and make him discover different food. So I'm not talking about changing food all the time. No, but in very tiny amount, you need to make them used to eating a bit of kibble, eating a bit of wet food, eating a bit of human food like raw meat or tuna or chicken, that kind of thing. This way, when they will be adult, they will be able to adapt to a different food. And it's true that when you have a cat that only wants to eat hard kibble and the cat has a kidney disease, it's very problematic, because we would like wet food to keep the cat hydrated. Maria from Italy asks, how do I tell if my cat is getting enough nutrient? Are there supplements I can give? Well, I don't know about supplement, because I think it depends on your cat's condition. But if you're giving a complete diet that is adapted to the age, weight, and condition of your cat, normally it's okay. And again, you need to monitor weight and monitor the general health of the cat. You know, is he active? Is his hair good, looks good? That kind of thing. So complete diets adapted to the cat's age, condition, maybe breed, and also monitoring weight again. Louis from France is asking, when should you use an appetite stimulant? Well, I would say maybe on the recommendation of your vet, because your vet will let you know how serious the problem of your cat is, and will probably offer an appetite stimulant if really the appetite is decreased a lot. So talk with your vet and they will probably recommend an appetite stimulant. Excuse me. Yes. So Ashley from California asks, why does my cat make grinding noises when she eats? Well, thank you for this question, because one of the symptoms of nausea is also grinding noises. So when I said in the presentation that the cat seems to eat from the corner of the mouth and has difficulty chewing, sometimes you also hear grinding noises. So it's one of symptoms of nausea or of mouth or dental problem. Again, except if it's already identified, a visit to the vet is indicated. Well, thank you, everyone. That wraps up our show for today. This show will be saved and uploaded to YouTube if there is anything you missed. And feel free to send questions to askmuthian@gmail.com. Thank you for everyone that tuned and shared our event from today. So the winner of the draw will be announced next week. So make sure you are following the Muthian Facebook page. Thank you very much, and have a great night.